Welcome to the MCOL Podcast, a podcast from the great people and partners at MCOL. If you're in the business of healthcare, MCOL is in the business for you. At MCOL, we're proud that since 1995, we've been a leading publisher of healthcare business information, webinars, training software, resource books, directories, web content, and now podcasts to healthcare professionals. We help leaders unwrap healthcare business information through a variety of membership solutions. MCOL memberships serve health plans, hospitals, provider groups, physicians, pharmaceutical organizations, employers, government, research organizations, and many other companies. Check out all our great resources, including the MCOL Podcast at MCOL.com. You'll also find MCOL podcasts on iTunes, Google Play, and many other podcast directories.
Joining us today is Rick Grape, Director of Innovation for Healthcare with LexisNexis Risk Solutions. Rick, welcome to the show.
Thank you, Paul. I appreciate you allowing me to join you today. I'm excited to share with you and the audience a fresh perspective on the challenges faced by organizations that are combating fraud, waste, and abuse in the healthcare space.
Well, Rick, thank you so much for that, and it's a pleasure having you here with us today. Tell us a little bit about your background in healthcare and your role with LexisNexis Risk Solutions.
Thank you, Paul. So I've been in the healthcare and government space for going on near a decade. I serve as a market planner and have been doing so for the past 5 years. It's kind of a unique position in that I get to act as part futurist, part visionary, and really as a strategic leader that helps direct our overall market, product, vision, and sales strategies for our organization. It's kind of a cool role because we get to essentially gaze into our mystic crystal ball, so to speak, and be the prophet that indicates where the market seems to be going and how to actively build solutions to help address what's coming in the future, the challenges that we suspect the market will be facing, and how best to address that over time. So in this role, I look at industry trends, evaluate what they mean to our business, to our customers' businesses, and try and cast a light onto the exciting future to where they're leading us. For my background, prior to coming to LexisNexis, I actually hold degrees from St. John's College in Annapolis, Maryland, as well as an MPA from Cornell University. So I bring really a unique perspective of research and analysis that looks at really cross-markets, as well as more of a political theory and political philosophy background that I've been able to bring into this public-private partnership space. While on the government side of our house, which is where I've actually been for most of my tenure at LexisNexis, I've had an opportunity to serve as a subject matter expert working with Medicaid agencies, the Medicaid fraud control units, the MFUCUs that exist within each of the states. I've worked actually for the better part of the past 5 years on a vital contributory initiative, the National Accuracy Clearinghouse. That's a contribution aimed initiative of bringing beneficiary data together across state lines in order to identify instances of dual participation, so where one person's receiving more than a single set of benefits, or even cross-program impacts of where folks might deserve to be on certain rosters for state programs but aren't currently aware just due to a lack of knowledge. So I've been working heavily on that project for really the half of my tenure at LN for the past 5 years, working with state partners to define business rules, define what that solution should look like long-term. And as I've moved into this space for fraud, waste, and abuse, I've had an opportunity to engage more and more with the CIRRUS project, which is a similar contributory type network of stakeholders powered by LexisNexis and organized through NHCAA. And I'm looking actively at other ways that we can bring more of that collaborative vision to fraud, waste, and abuse industry-wide.
You have a really interesting background, Rick. So let's talk about this area that you mentioned just a moment ago, fraud, waste, and abuse. And let's maybe get specific and talk about some of the key challenges that face health organizations today in their fight against this area, this big area of healthcare fraud, waste, and abuse.
So the first area I'd say that is the biggest challenge is that fraudsters are increasingly becoming more and more sophisticated. So it's no longer an approach of how do we prevent folks from getting our information. As we've seen over the years, situations of data breaches have occurred left and right. On the dark web, it's very easy for folks to get a hold of a name, social, address, date of birth combination that can be purchased for as little as $5 online. We've seen, or really since 2012, an increase in government fraud that went from 10% back in 2016 through 50% in 2012. So it was a pretty big change. And how we approach the market is that all identities have already been compromised. It's really just a matter of time before we see those compromised identities reemerge. So as we talk to health organizations about how they can help combat fraud, waste, and abuse, a key component of that is helping to identify situations where those good identities that have been compromised are being used by bad people. So as a component of that, I'd like to get organizations to think a little bit more broadly as they really start to discover and verify and assess identities during their prevention workflows, their first enrollments of members or providers into the networks, or really even at every touch point where they might interact with them moving forward, to conduct a much more thorough verification and assessment. Now, we see in a lot of industries, things like that are already being done through various means. Knowledge-based authentication, really things that you know, are proofing type questions that are pretty commonplace across both financial services as well as becoming more commonplace in healthcare. They're questions like, what color car did you own in 2005? What address did you share with this person? Things that really you as an individual are only able to answer. There's other ways that verification can expand beyond that historical data, and that is, I think, pretty critical because that data ultimately, with a certain amount of time or window, can be researched by a lot of folks that are starting to defraud different organizations and programs. So some other ways that we're starting to see industries transition is to move towards one-time passwords, things like text or email tokens. I'm sure you've seen those or interacted with those in some of your day-to-day.
Yes.
Document captures, like capturing the driver's license and pulling that information off of it to verify. These are ways to make sure that you have something, and that's kind of a step two from going from something you know to something you have. As we start to see these technologies really evolve further, they start to move into really biometric or even context-based approaches. So biometrics being like voice recognition, facial. If any of you use Clear, you see they now have iris scans and fingerprints in the airports. You use a finger to access your phone, which is registering that Touch ID. So these are things you are. And then the context, are you behaving outside of the norm? Is it that you're coming from an IP that's out of country and you don't typically get seen there, or from a device that's not one that you regularly access our system from? So this kind of growing fuel of or cycle of enterprise risk management is taking us from the standard face-to-face interaction or the proof of an identity being just the PII or basic demographic information, identifiable information being entered, and instead taking a much more robust layer and showing really the proof is in the pudding. You own this identity. It's not one that you borrowed from someone else or captured or purchased somewhere online. For fraud, that's kind of critical because the last step to me outside of really evaluating these identities at the point of interaction is how do they differ from their peers? And there's a lot of different things that fuel that, some of which is using risk scores, different known bad actors or watch lists. And those are just as critical for the consumers that are interacting as well as the providers, since we see many providers pop up on sanction lists or deceased lists. Sometimes someone will have criminal records that can give insight into their risk as an individual. And those things are kind of this new front-end approach, and we're seeing as kind of an industry trend, this move towards preventative interactions is one that is really having the biggest return on investment for all parties involved. We have a lot of industry-specific tools that fall into what I call more of a detection phase or category, the deep dive challenge of how do you identify social groups, how do you effectively map relationships, and I'm happy to spend some time and talk about those, but they really have the challenge of how do I bubble up the biggest cases with the most actionable information after funds have already gone out the door.
Rick, can you explain how technology is being used to combat fraud, waste, abuse, and specifically about the roles of identity assessment and risk prevention?
Sure. So there's really a number of layers that make that up. Identity resolution is one, but looking with really a lens of enterprise risk management, all the ways we see that person based on outside data, our claims themselves, so using data mining tools and predictive models that look for statistical outliers and help bubble them to the top, and then ultimately to map relationships, gives plans an opportunity to look at fraud, waste, and abuse through a multitude of different lenses. Ultimately, contributory networks, the new initiatives that they can take to collaborate and bubble up each of these bad actors, I think has the greatest value for all parties involved. So we've talked a little bit about it from the prevention side, and there's a bunch of tools that can be plugged and played into workflows, whether it's someone that's enrolling or even accessing a portal to look at like their EOBs or interacting with a pharmacy. The detection piece really is where you start to get into, has a specific code been used? Is this provider billing outside of their peer group, their norm for specialties? Are they a high code user of a specific type? Or even looking for things that should occur together but are just missing. So if you typically go to an office visit, you're going to have 10 steps that they go through, or there are only 2 or 3 steps indicated on a specific claim. These business rules really are driven by a more claims data mining layer to place roadblocks for future interactions based on those past experiences. So they tend to leverage thousands of rules in these different categories to really prioritize and optimize where resources are spending their time, marrying that often with a lot of different scoring mechanisms that help calculate how likely they are as a risk based on their level of suspicion, the likelihood to recover from them, and abnormalities really compared to others in their network. So that approach is kind of fueling some predictive models. But Paul, it sounds like you got a question. Jump in.
Well, I'm sorry for interrupting, but I was gonna kind of draw a line then to this notion of collaboration in contributory networks, and it sounds like that's really where you're going with all of this. But it just massive amounts of data. So elaborate a little bit for us here on this idea of collaboration and just the vast amount of contributory networks that are out there, kind of feeding all of this information.
Sure. So contributory networks, in my mind, are an opportunity for folks to, in one case, for organizations, in one case, grow slightly outside of their comfort zone in many cases, because it is starting to push the status quo, so to speak, but really to start to benefit in ways that can inform every step of their decision-making process from the get-go without putting barriers in place towards accessing a wealth of intelligence that would otherwise go unknown. So I like to use, as I'm talking to folks typically about the concept of contribution or contributor, I actually like to use an analogy, stone soup. It's a parable back from France in the 1700s, but it's where essentially you've got a traveler that comes in and he builds this stew with ingredients from all of the different villagers. And at the end, everybody gets served out a portion. So someone might bring a carrot to the table, a potato to the table, a piece of meat, et cetera. All these things that are just lying around that they have in their homes, they have access to, they were keeping just for themselves, and instead get something much more robust, much more flavorful out of that aggregation and amalgamation of different ingredients. In many ways, plans, in many ways, SIUs, all of these different health resources have an opportunity to leverage each other's intelligence because, for better or worse, we all have a limited scope of a member, of a provider, based on our interactions with them and what's commonly available. So I like to use myself as a good example, and I see this in a lot of our our resources that we have at Lexis, I move a lot. I've bounced around into 9 different states over the past decade. So if I went to any one of those states independently, their view of me as an individual would be limited to where I enrolled, my driver's license at that point in time. And they don't always get that clear picture that, he moved out of the state permanently, so shut off all of that intel and then aggregate new intel as these emerge in a new location. So when I look at like state systems, I still have a couple of voter registrations that haven't been closed. And you went to them by themselves, you'd have a limited scope of me thinking I'm necessarily local, and I'm not. Similarly, with information on members and providers, we've got all of these narrow scopes of who they're in a network with, who they have interacted with historically, fraud that they've occurred or perpetrated, even if it's not fraud intentional, maybe they've accidentally upcoded for some service over a period of time. Maybe they have someone in their network that makes them more suspicious because they've got a similar specialty and they've committed fraud before and they've got personal ties. Maybe it's a spouse's sibling or something like that. So being able to pull insights together are kind of like combining those ingredients. Each one of us has kind of like a looking glass view of each of these entities we interact with. And when we can pull that glass away and link all of those individuals that we see in these one-off instances, we can actually get a great bigger picture. Billing hours is one easy example to kind of think about. Does a provider bill one plan for 40 hours, another plan for 40 hours, and another plan for 40 hours? Well, if so, that 120 hours is
it's a lot of time.
high for a single work week, which nothing looks suspicious independently, but when you bring it all together is where you can start to see a bigger picture. Mm-hmm. As I've done work in the government space, it's been similar. We've got all of these members or beneficiaries that are enrolling in different programs. It's like, do they have a different social for one program to another? Do they have a different set of dependents from one household to another as they've been captured? John's not suddenly going to go from 3 kids that are all 5 to 10 as they interact with Medicaid, and then 6 kids that are all 10 to 15 as they interact with SNAP, without there being some kind of trail. So being able to link those things together, see, no, that social differs, that address differs, there's an extra dependent here, someone else is living with them, gives you, really greater insight into potential risks that might come from them. So as I think of contributory or contribution, I think back to that stone soup analogy, because there's a wealth of intelligence and really a wealth of systems that have captured this for other industries that healthcare has an opportunity to learn best practices from, and in many ways duplicate or replicate. So some of those that LexisNexis works with are things like CLUE. It's the Comprehensive Loss Underwriting Exchange. Anytime you've ever applied for any type of insurance, you go through this database. I applied and bought a home not that long ago, and I got a notification I was being hit against CLUE. It's a property and casualty database that assesses your risk as you apply for insurance. The Florida Department of Law Enforcement contains a database of known criminals, criminal activity, locations of crime, so that they can help expedite police efforts as they're interacting with those locations or moving quickly to an area where they need to respond. The National Accuracy Clearinghouse Project I talked about before is a government system to identify public assistance dual participation. So it is, at its core, kind of a glorified duplicate finder. Is this person already receiving benefits somewhere else? Because you should only receive food stamps once within your state, and certainly not in multiple states at the same time. We see and have tested a bunch of programs like Medicaid, TANF, these other HHS-type programs that we're seeing those same sort of insights from, where folks are popping up in multiple places and all of them have in-state residency as a requirement and component. So that simple knowledge of this individual at this location with this information to identify them can be shared and leveraged, and in many ways could even help combat things like the opioid crisis, which I know is a topic that's on everybody's mind. Being able to share, this prescriber is prescribing more opioids than every other prescriber that we interact with, or this pharmacy is one where we see a lot of traffic going to. It could be that the pharmacy is kind of acting like a pill mill, but it could also be that it's just got less secure mechanisms in place to help verify identities, so it's a target. Being able to aggregate that information and see, well, all of these folks that are receiving this prescription go to this one place, or this doctor is prescribing to a whole bunch of people in this one individual social network, which is really weird because you shouldn't have, and you don't typically find a member with family members and close associates that are also all receiving the same drugs. To be able to see that picture, it requires data to come from multiple sources, and then also, back to what I was mentioning before, it to be intelligently linked together. Because identity resolution is hard. Just because I'm, Richard Grape in one instance doesn't mean that I haven't put myself forward as Rick Grape or Dick Grape or any of the variations that could help mask or skew me from being linked effectively.
Thank you. That is really helpful. Data, by its very nature, is complex and complicated, so it's really good to hear those analogies. I very much appreciate that. Let's jump into LexisNexis Risk Solutions, the area that you're responsible for. Tell us a little bit about how LexisNexis Risk Solutions is positioned to help health plans balance data sharing and information security.
Sure. So the short of it is we've actually had an opportunity over a very long period now to build, host, and engage on a bunch of different contributory initiatives. As I mentioned before, some of those databases we worked on are things like Clue, NAC, Cirrus we host for NHCAA, MIDEX, which is a mortgage exchange, FDLE, SBFE, the Small Business Financial Exchange. These are all one-off instances where we've been kind of the technology provider, either directly building or hosting the solution behind the scenes. And that's given us an opportunity to learn what it really takes to collaborate, as well as which barriers will have to be overcome. So we see, as we engage with any team of stakeholders, that there's a wealth of legal and regulatory hurdles, privacy concerns, security concerns, concerns about the technology, how big the system's going to grow and how quickly, who owns the data, who owns the liability for a breach, things like that. And leveraging an asset like, or an organization like LexisNexis that does big data day in and day out, pulling billions of public records together, proprietary sources, linking them and aggregating them, so that you can quickly go and find someone and all information tied to them, is kind of the entry point to take data from all these contribution sources and bubble up insights. So we found, as we've interacted with many different organizations over the years, that the components of a contributory infrastructure that are really needed are permission matrices, contract language that really helps standardize a base set and then allows for some flavors as organizations need to alter certain components, as well as the things that can't be changed. So things like data sharing agreements. Once that's set up and agreed to by all parties, it typically has to become a static document that has to clearly outline, the actionable use cases, the responsibility of who does what with the data, how much is permissible, what scope and really permissible purposes they can take as they interact with that information. The other piece that is hard and often requires a wealth of collaboration from all stakeholders, but that I feel we've got a great opportunity to help put a framework in place for, the business rules. And that's really the timeframes that are tied to what you do when you have the data, who takes ownership, who progresses it forward. We've worked with a bunch of federal entities, FNS, CMS, different industry oversight bodies as for each of these projects to help standardize and create and keep all parties enrolled and soliciting to really the same set of business rules and process. Because if one party differs, in many cases, the whole thing falls apart. So you have to have that kind of core buy-in from a group of stakeholders at each organization. They have to remain engaged and participating and come to a framework before any information even starts being shared. Now, we've had an opportunity to do that. I've actually had a hand in writing business rules and data sharing agreements for a bunch of government programs as they've been working to share data. So this kind of framework gives you the opportunity to bubble up things like provider risk or member risk. And it needs to be both at a technology level as well as a process level within any of the organizations you hope to interact.
Fascinating stuff. My thanks to Rick Grape, Director of Innovation for Healthcare with LexisNexis. Rick, thanks so much for joining us today on the MCOL podcast. And if listeners are interested in learning more about LexisNexis Risk Solutions, they can check out https://risk.lexisnexis.com. We'll put that into the show notes so everybody can find it directly. But again, Rick Grape, thanks for joining us today on the MCOL podcast.
Thank you.